learning a little bit more about health with Half Hour to Wholeness. First of all, I want to talk to you about how I come up with some of these topics, because one of my goals as a healthcare provider is to give you information on how the body is integrated. You know, we tend to be taught as we're grown up that the body is this series of systems and the systems really don't work with each other. Like you have the circulatory system, you have the digestive system, you have the nervous system, and yet all of these systems are really fully integrated. And as I've done lots and lots of reading over the last 10 years, I've seen patterns of articles that I get that actually show how the body's integrated. And I get these ideas on these talks based on some of the literature I've read. And the basis of all of my talks, of everything that I talk about, is this: the body heals itself. Body heals from above down, inside out. The body's an intelligent organism. It has a capacity to heal itself. When we adjust subluxations, the body heals. Now, what's the connection between vertigo and the neck, okay? And most people would not necessarily even think there's a connection there. Vertigo is a sensation of feeling of being off balance, you know, and it's dizzy spells. Sometimes you feel like you're spinning. I've actually had them. And vertigo and balance issues can be caused by an inner ear problem. But other common causes include Meniere's disease, vestibular neuritis, which is a inflammation of the nerve in the ear, head or neck injury, brain problems such as stroke or tumor. Certain medications can cause ear damage, and certain medications can make people dizzy. Migraine headaches can cause vertigo and dizziness. Aside from an unbalanced feeling and dizziness, some of the other symptoms of vertigo, and some of you may have had this, you feel like you're spinning or tilting or swaying or being pulled one direction. Sometimes there's nausea and vomiting, jerking eye movements, headaches, sweating, and ringing in the ears. Now, ringing in the ears is something that's really common. I think a lot of people got that by listening to music that was too loud when they were younger, and I was one of those people that did that. The term cervical vertigo, though, meaning vertigo or dizziness or coming from the neck, that was first introduced in 1955, so this has been around a while. So we've known over 60 years that problems in the neck can cause vertigo. Now, that's been out there for 60 years. How many of you guys knew that? Nobody did. Why? Because when we think of vertigo, we go to a physician for vertigo, we get a drug, right? It's always a pharmaceutical, okay? But it's been around for over 60 years that neck problems can cause vertigo. So if you go and you get a drug for vertigo, how's that drug going to know to go to your neck and fix your neck? Yeah, it doesn't know that. So cervical spondylosis or degeneration is a common cause of chronic neck pain. People with cervical spondylosis tend to get vertigo more than others. So people with degenerative disc disease in their neck get vertigo more. People with cervical spondylosis may be the cause of vertigo in 50 to 60% of elderly patients. So think about this, 50 to 60% of elderly patients that have vertigo probably need to see a chiropractor, because that is the issue right here, is this degeneration in the neck. Now, here's a normal vertebra spine. This is a lumbar vertebra. Here is what it looks like when it's degenerated, okay? And you can see that degeneration, lipping, the vertebra, the disc is really thin there. Here's another picture. You see bone spurs, degenerative disc. Here's a neck that's badly degenerated. You see these huge spurs off of there. That's called cervical spondylosis. And that's what we're talking about here. What we're going to find is that there's a direct connection between cervical spondylosis or degeneration, which a lot of the people that I see have, and vertigo. Now, we know now, based on published research, that elevated sugar consumption leading to metabolic syndrome and obesity can cause spinal disc degeneration. Now, that's pretty interesting. Think about this. We've always thought that spinal disc degeneration is just a wear and tear disease, and it is some of that. But eating too much sugar and having high amounts of sugar can actually cause the disc to age. And that was in an article published in an online journal called Public Library of Science in 2016, so about 4 years ago. So one of the things that you can do to slow down the degenerative process in your spine is just cut back on sugar consumption. Don't eat much. Okay, I'm not saying you can never eat it, but don't eat a lot of it. Another theory is that vertigo is an internal derangement of one or more joints of the upper cervical spine. So these joints, the atlas and the axis, very heavily innervated. Lots of nerves go in and out of here. Very important area for blood supply to the brain. So receptors for vertigo are deep in the ligaments of the neck and in the intervertebral joints. Now, I'm going to ask you a question. I've asked this question before in my talks. What do ligaments do? Tell me what they do.
They hold attachments like your muscles to the bone.
Tendons attach muscles to bone. Ligaments hold bones together.
Okay.
So that's what ligaments do. Ligaments hold bones together. Okay? What else do they do?
Cushion? Does it help cushion?
In the spine it does, because the discs are considered as ligaments.
Okay.
So that in the spine they do. But here's what else they do. Ligaments are very heavily innervated, which means that when you tear them, they hurt.
Yes.
Okay? So the fact that they're innervated so heavily, that's very important, because what ligaments do is when you move your neck and the ligaments stretch, they ping those nerves, and those nerves tell your brain where your head is in space and time. So your ligaments tell you where you are, okay? Mm-hmm. So if you have problems with ligaments and degeneration, which always includes ligaments, that can cause this misinformation to the brain and contribute to vertigo. So ligaments are really, really important. And when I give you your neck exercises to do especially with the Denerol, what we're doing is we're stretching ligaments that have contracted and caused your neck to straighten out or reverse. So that Denerol is actually stretching these ligaments into a different position, a more natural position, because they've contracted and they're holding your neck in a position that's not good for your neck. So patients with cervical spondylosis have significantly impaired posture control, balance, and disturbance. So the more degeneration in the neck you have, the more problems with posture you have, and the more problems with balance. And I see people with balance problems all the time. In my room, and you've seen me do this. Mm-hmm. I test balance, because balance is a very important human function. I have people bring up their leg, and I say, I want you to see if you can balance for me for 25 seconds. A lot of people just fall over when they do that. Well, that's not good, okay? So cervical spondylosis affects balance, and I see it all the time in practice. Now, I want you to look at this picture right here. This is the way a head should sit right here. What do you see here? You see this head moving forward, okay? And that bowling ball I have in my office in the other room, that's what that's for, because your head weighs somewhat less than a bowling ball, but when it moves forward, it puts a tremendous amount of stress on your neck and on your spine. So we're trying to correct that. So we have 12 pounds of pressure on your neck here, 32 pounds here, and 42 pounds here. So when I give you neck exercises, we're trying to pull your head back to normal. And I've been pretty successful with this. We're seeing some really good changes on x-rays. Now, cervical spondylosis will happen much quicker and at a much younger age when you practice poor posture. How many of you see young people doing this?
Yeah.
See it all the time, every day, okay? So it'll happen a lot quicker if you're doing that all the time. Cervical discs are supplied to what we call mechanoreceptors, and these are receptors in the body which monitor position, acceleration, and velocity, or so where your body is in space and time. This phenomena is referred to proprioception. So proprioception is knowing where your body parts are, all right? A lot of those proprioceptors are located in the discs in between the vertebrae and in the ligaments. Proprioceptive input from the neck participates in the coordination of the eye, head, body, and spatial orientation. So if your neck is off, if you're having problems in your neck that's giving the brain bad information, yeah, your eyes are going to go over the place, you're not going to know where your head is, and you're going to get vertigo. All right? So the deep neck muscles, which are these here, okay, possess a high density of muscle spindles, which play a role in postural control. So one of the things that happens, and this is really important, when I laser your neck, we are actually normalizing these muscles, okay? So the laser actually normalizes muscle and muscle spindle function, okay? That's why I use it so much. It actually causes the neck muscles to function in a more normal manner. A diseased disc, which is right here, causes these receptors to feed abnormal signals into the eye, into the muscles of the neck, into the central nervous system, leading to a mismatch of information into the balance apparatus in the inner ears. So that's one of the things that causes vertigo, is that misinformation from the disc, from the receptors in the disc. Diseased discs cause inflammation, which causes the mechanoreceptors to misfire. Now, patients with cervical root compression may have significant impaired postural control, balance disturbance, and vertigo. And the nerve roots are the parts of the nerve that come out of the spine here, right out of the spinal cord through the openings in the discs, in the vertebra. Those are called the cervical nerve roots. Now, let me ask you something. How do cervical nerve roots get pinched? Anybody? How's that happen?
Compression of the bone, or compression of a joint, or compression due to lack of collagen or any kind of distance between the different vertebrae.
Yeah, so you can have a herniated disc. That will do it.
Swelling.
You can have inflammation in the joint. You can have bone spurs that are in arthritis that's putting pressure on it. And when the vertebra degenerates, or when the disc degenerates, that opening closes off. Now you have all this fatty tissue and blood vessels that actually start compressing the nerve, because it's not just the nerve that comes out of there. There's fat, there's veins, there's arteries, there's lymph nodes, there's all kinds of things in that space. So all of that can start being compressed when you have cervical disc degeneration. And anytime you start having compression in a nerve root, usually the sign that your nerve root is compressed, you have pain down a limb, like an arm or a leg. Okay, that's nerve root compression. Okay, so that's definitely a sign of nerve root compression. But along with that, that impairs posture, balance, and it can cause vertigo. Now, patients with basilar arteries insufficiency often complain of vertigo. So this is the artery right here, the cervical artery that goes up into the brain, it's what's called the basilar artery right here. How would that artery get impinged? What are some of the things that might cause that artery not to allow enough blood flow to the brain? What do you think?
Bone spurs, maybe muscle swelling, and maybe anything to do with compression of the vertebrae would cut
Yeah,
down on
yeah, bone
blood
spurs
flow.
for sure.
Yeah.
But there's something else. There's a couple of other things that would cause this artery. And we've actually had some pretty good chiropractic research on that. What do you think might cause that artery to stretch and not and kind of close off a little bit so the brain would not get the blood supply it needs? What do you think might cause that? Let's say you don't have bone spurs. Let's say you don't have any disc degeneration. Okay? What other thing could cause that?
How about a herniated disc?
Okay? That's a possibility. Usually a disc would have to be pretty herniated to interfere with that artery. How about a reversed curve of the neck? So the neck, instead of being curved like this, curves backwards. That would stretch and pinch that artery.
Yeah.
Well, we know that happens because we have really good research on that right now in the chiropractic profession. That is another reason why I want to put the curve back into the neck, because this artery here needs a normal cervical curve to get blood supply into the brain so the brain can work properly. So that's why I have people lay on their Denerals, because we want to bring that curve back into the neck, because that artery functions properly with a normal cervical curve. Now, I want to watch the way the artery comes up. Comes out of the superior vena cava, no, it's a dorsal the aorta. Comes up here, and notice how it comes through the transverse process of the atlas and comes around and up. So it makes a couple of really hairpin curves right there.
Yeah.
So now think about this. So the atlas sits on the axis like this, okay? Well, more like this. So if the atlas is rotated and shifted, which I see in a lot of people, can you see how that might affect that artery? That's a subluxation of the atlas. That can affect blood supply to the brain. That's how chiropractic care can help that. How many people do I see atlas subluxations in? Just about all of them. Okay. Now, people are anatomically different. I mean, some people have really big openings and small arteries, so they can tolerate a lot more play. Some people have smaller openings and big arteries, which would be you have far less tolerance for subluxation. So you can see how the neck plays such an important role in function of the brain, making sure the blood supply gets to the brain. Now, some researchers believe that there's a direct link between cervical disc pathology and interference with the vertebral artery. Now, that's what you were talking about,
Yeah.
Terry. It's
Yeah.
exactly what you were saying. So a bulging disc, when you have cervical disc pathology, they're saying that may interfere with the vertebral artery going up the neck. That came out of a journal called Pain Medicine, January of 2015. It's about 5 years ago. Chiropractic adjustments can greatly assist in restoring normal mechanics of disc function. And you can see I use that machine all the time, and that's what we're doing. We want to align the vertebra, we want to align the discs so the neck moves freely, and then have you do the neck exercises at home to really help bring that curve back into the spine. And that's exactly what we're doing when you come into my office. So there was a study involving 80 vertigo patients. This was published way back in 1974 that demonstrated that specific cervical manipulation of the spine along with correct sleeping posture produced the following results. 73% showed significant improvement in both symptoms and electronystagomyographic recordings of the head and neck movement. 53% of patients had complete relief of symptoms. 36% had significant improvement where they required no medication and could return to normal activities. Now, this is a study back in 1974. It's been around for a while. You know, I was still in college back then. You know, anybody heard of this study? No, because the study does not involve pharmaceuticals. That's why we don't hear these studies.
Mm-hmm.
You know, but these are. That's why I do these talks, because I run across these studies. We need to know about this stuff because this substantiates everything we do in a chiropractic office. The authors of this study concluded that cervical vertigo responds quickly to physical treatment in a rewarding proportion of patients. Clearly, chiropractic care should be the first choice in treating vertigo. Okay, so chiropractic improves health, sleep, stress, well-being, immune system strength, life, mobility. It decreases disease, illness, pains, injuries, body, bad posture. And I'm not saying that chiropractic can cure all vertigo all the time. I'm not saying that. What I'm saying is this: it should be a major choice when somebody has vertigo. And why not, with all the information out there, why not try chiropractic first? And what I found with my vertigo patients is that sometimes it takes time. What happens, what I've seen with chiropractic and vertigo is this, is that once a person begins to develop symptoms, vertigo symptoms because of neck problems, they've been having issues for a long time. This usually isn't just something that just happens overnight. And because of that, it takes time to fix it. It doesn't happen in a week or 2 weeks. Sometimes it can take 3 to 4 months, 5 months, even 6 months to really correct this issue because it's something that's been around for quite a while before they get the symptoms. So that has been my experience with chiropractic and vertigo. It can really help it, but sometimes it takes time. So, on July 16th, we're having a we're having a patient appreciation day. And, you know, you may know some people out there that suffer from vertigo. And if you do, you know, we'd be happy to take a look at them that day and do a complimentary subluxation check to see if they have a problem that we can help that may be causing their vertigo. And so we still have some slots open. We still have about 3 or 4 slots open for that day to be able to do some free complimentary evaluations. So most of you know people who are suffering from problems and they're not getting help for. And in fact, just yesterday, I saw a woman, I won't tell you where she's from or how old she is or anything like that, but she had this long list of surgeries, this long list of drugs. Her quality of life was terrible quality of life. And here's what she told me. She says, I've had all these surgeries, and I really don't think any of them have really helped me. That's what she's telling me. And she'd probably had, I don't know, 6, 7 surgeries. She's taking maybe 6, 7, 8 medications. She wanted to get off of her drugs, and she wanted her life back. She wanted to feel good again. She's in my office. She didn't want any more surgery. She didn't want any more drugs. And here's what I found. After 40 years of practice, you know, even though drugs and surgery can be very beneficial at times, it's our body's ability to heal using the chiropractic care, good food, good exercise, good nutrition is really what creates health in our body. It's not all these drugs. It's not all these procedures. If that were the case, this woman would be the healthiest woman in Lincoln, okay? But she was in my office. She was so broken down. She had so many symptoms. She hardly knew where to start. And so we can prevent a lot of that. And what I'm saying is this: just talk to some of your friends that are sick. At least get them checked. They don't have to be a patient in this office. At least get them checked and see if we can help them. So that's all I have for tonight. Now, June 30th, which is 2 weeks from tonight, we have a great talk. It's called How to Shrink Your Brain. Okay? That talk takes all the medical literature that I've come across in the last 10 years on what causes a human brain to shrink and dysfunction. And I put it all into one talk so you can find that out. And if you have any of these issues, these habits that cause that, you come to that talk and you're going to find out how to create a healthy brain. So, thank you so much for coming tonight. God bless you guys, and we'll see you in 2 weeks.